We go. Um, Thanks so much, Kate. And it's always fun to have extra time at the end with a smaller group because it's more conversation. Um, so in our group, which actually ended up just being Liesl and I, which was great. We talked about research collaborations and how that can be strengthened. And we were talking about the need for, one resource would be for Global Arch to both educate the patient family organizations about research and how they can partner on it, and also educate the clinicians because they tend to be, most people are bad at it. So, creating really clear tools and possibly trainings to say, here's some key points, here's some models, to help clinicians who want to partner on research actually do that. And always going back to the idea of, as Kathy was saying, make sure what you're researching is what people care about, right? So those ICHOM metrics are really good. The other thing that came out, which I think is a really important issue, which is not talked about enough, is if any group that is serious about North-South collaboration really needs to understand the realities of North-South collaboration. And I'll give you a very concrete example. You can't have meetings that are always in the middle of the night for people in other time zones, right? You can't have an organization that has fees that, although very affordable in your country, is more than the monthly salary in that other country. And that probably translates, I would say, to other organizations in terms of if we want to create these collaborations that are really addressing health equity, then we need to make sure that in our own groups, we're thinking about how do we strengthen those voices and make sure that the voice that is at the front is not just the privileged people at the table or the groups with a lot of money. Liesl, did you want to add anything?
I think you did a great job. Thanks, Amy. It was great chatting with you.
Thank you. That's wonderful. And that's actually one of the timings is a key thing. That's one of the reasons why the virtual summit was different hours of each day to really address the different time zones. And it's hard finding a time that works for everyone, though. And I think that's still something that we're striving to accomplish. I love that, though. Thank you, Amy and Liesl. I'll now turn to Kelly. And I had to actually also apologize to our moderators. There were some moderators in the same room. So Kelly, I'll turn to you, though, to share.
Sure, yeah. So it was a privilege to chat with our group. We were a little slow to warm. So ultimately, we would have benefited from a little more time to discuss around the table. But I would say the key message that came from our discussions is that collaboration amongst partners is crucial to guiding those passionate efforts, balancing sort of scientific rigor, sort of academia, as well as data, but also the lived experiences. And I think the key is, regardless of where you are on your journey of that ultra marathon, it's so important to identify the strengths of each organization or every partner so that as you move toward action planning, the actions are aligned to those strengths or potentially overlapping just to get the most sort of drive for your impact. So that's what we sort of concluded in our group.
That's fantastic. Thank you. Sheila and Meg, who would like to report back?
I think I'm the reporter. We had 3 people and then one that was kind of a no-show. So it was very similar to what Kelly just said. Collaborate and find and maintain a common ground. Need to focus on mission alignment, or else there's just so many other things that you can just wander away and start working on. And as an organization, Global Arch needs to maintain a broad stakeholder range so that people are included and engaged and don't wander away. So that was a good reminder to do that. So that was sort of basically what we were talking about.
That's great. Thank you. Disty, I'll turn to you.
Kate, thank you. This has been an amazing morning. And I had 2 people in my group, and they're both in Mexico, and they're both trainees of cardiac surgery. So one is a medical student and one is a resident, and they were wonderful. I think, their goals were collaboration, but they actually had no patient follow-up. So apparently at their situation, the patients are never followed by the surgeons. And then some of the patients self-refer until they don't have a local cardiologist that they should follow with. So I think that is an area where we can think about collaborating at the very basic level to make sure that they have some relationship with the cardiologists who follow the patients. They follow mostly, but some pediatric patients, mostly adults. But I think a collaboration is still the key.
That's wonderful. Thank you. Carissa.
Hello. Okay, so our group talked about finding ways to make connections with groups. And we talked about how Global Arch has really helped facilitate a lot of us meeting each other and learning from each other, which was great. We also kind of talked a little bit about utilizing the patient voice when making connections. And also sometimes the stigma around that. So people who are afraid to share, how can we look at those ways? And then we were just about to start talking about ways we could collaborate together, but then we got kicked back out. But a lot of it was talking about how just Global Arch has really helped us kind of meet other groups within the United States or globally that we can connect with and utilize information.
Thank you. Oh, Zoom. Apologize for that. Thank you for that. That's fantastic. Lola.
Hi. I was lucky enough to be with Audelia and Amaya because we've been doing things together, so it was great being able to talk about this. What we were saying is that it is important to recognize the strengths from other ONGs and actively and immediately, in order not to, let it just pass until the next meeting, start to collaborate in some way. Knowledge, how-tos, materials, manuals, whatever, even mentorships in specific projects. We could feel maybe with your help, Kate, survey in Global Arch, saying what we can offer, donate it, and what we need. For example, since we were talking about the IQIC, I'm working on a manual, for example, on how we started and what are the steps to do it in order so that it doesn't seem impossible, no? So maybe I could share this or help someone through that way. Also, Amaya has amazing, in Spain, she has amazing manuals and more for families and patients. And she has this project where you sign a project with her and you can download the material. So she can offer that. So, and then Audelia, she was also working on that. And I think if we have a place where we can just write on what we can offer and what people are looking for, maybe that's the best next way to connect through Global Arch.
That's fantastic. Thank you, Lola. Grace.
A lot of time after introducing each other. But what one key takeaway was collaboration. It's collaboration with other alliances, and so together we can feed off the strengths and the good of the organizations that we collaborate with. And also with one thing we talked about is certain countries, because it's big, collaboration within the country as well, would help maintain the standard and the quality within the country as well. So yeah, that's our takeaway. Sorry, we didn't do question number 2.
No, that's absolutely okay. Thank you. And then I will turn to Alicia, Raj, or Blanca. I don't know who's going to report back.
Oh, I can report back if the team are okay with that.
Raj.
I'll let you jump in there. But thank you. We had such a varied and vibrant group and so much to talk about after reflecting on the day. So thank you all. We saw some real opportunities around with regards to data collection, around maybe looking at shared examples and doing some landscape work about what's collected where and why, and sharing examples of best practice so we can kind of acknowledge and see the gaps. And there was a real discussion around like policy implementation for encouraging governments to kind of collect the data and the benefits of that for everyone. We also talked about Similarly to Lola, actually, the low middle income countries, opportunities for collaboration with regards to access to care. So that could be equipment or, signposting organizations that do go to low middle income countries and can perform surgeries, etc. And then generally for Global Arch, or as partners together, we saw there might be a real opportunity for sharing projects and goals and our successes, echoing what's already been said today, but really being able to champion each other and the amazing work that's going on around the world. So that was our group.
That's absolutely wonderful. So on that note, I'm actually going to add in the chat a link to add your success story, if you have not done so already. And we will be actually featuring this in a registry on our website to share the successes from across the world of how what groups are doing and how you can connect with one another. So I just shared that in the chat, and it will also be in a follow-up to the summit. Before we fully close out today, I want to open, we do have some time, and I know the breakouts were cut short. So I would like to open the floor if anyone has any additional comments that they would like to address per the questions from the breakout session, or anything that wasn't mentioned in the report back from the moderators. So please just raise your hand.
Sorry, I couldn't find my virtual hand. But I just think, reflecting back on my my experience today with my group, I think it's very important that every country and every individual starts where they are. I think that, we hear about these tremendous successes, perhaps from the ACHA, although I realize that Mark doesn't always think they're tremendous successes, but they have been. But I think it's very important to make sure that we start where we are and then move up. It is a marathon and it will take a long time.
Thank you, Jesse. Is there anyone else?
Hey,
All
I
right.
have a question.
Yes, Carissa.
Does Global Arch have a way for members to see each other's contact information? So if there are ways we want to collaborate and partner with other groups, do you guys have do we have access to a list or something?
So we have our map on our website. I'll add it in the chat, but that you can view all the different members and partners who are part of Global Arch. It links to their websites, or if there is an email that's provided, we do link to that. In addition, for any of our members, our patient and family-led organizations, there is our WhatsApp group that you can directly connect with each other, as well as the monthly leaders forums. As well as if you do want to connect with anyone, please reach out to me or Sheila, and we can connect you with someone else that is part of Global Arch. But there's no formal list because of just for privacy concerns.
Okay, sounds good.
Mm-hmm. That's
India, can you hear me?
Yes.
Yes, we can hear you. Mm-hmm.
In India, we deal with the underprivileged children who are malnourished, anemic, and hypoproteinemic. This is a community-based malnourishment. And after surgery, they go back to the same place. They continue to be malnourished, but it is surprising because we have a long-term follow-up. Still, they grow well. They put up weight and height. Probably with better nourishment, they would do better. But initially, we have done nothing about nourishment. We just take them for surgery as they are. But we take care of anemia. Proteins we might give at some time. They go through surgery. Initially, we had problems about outcome. But now we have learned the art of managing it. Now our mortality rate is around 2.73 gross mortality. And for straightforward defects, ours is below 1%. Mm-hmm. The same children, what I'm trying to tell you is, the undernourished can also be operated this way. And they can have, without much of an exercise on our side, apart from taking care of anemia.
Thank you. Thank you very
Good.
much. I know your group is doing tremendous work in Chennai, and thank you for sharing. Unfortunately, we do need to move on to the closeout. Before we do, I'm going to hand it over to Amy to close out today in the overall summit. I want to thank each of you for joining and participating, sharing your experience, your expertise, especially to our speakers. I think Global Arch continues to have our core is patient and family organizations, and everything that we do is focused on empowering these organizations. However, we can't do this alone. It's not possible. And in order to really empower these organizations, we need other stakeholders. We need the medical community, governments, and other key organizations to really help empower them and lift up the voices of patients and families. And that is the key part of our new initiative that we have launched. But on that note, I'm going to turn it over to Amy, who is our board president, as well as a co-founder of Global Arch.
Thank you, Kate. Am I showing up?
Can I just make a request that Raj asked that we take a picture of all of us so that we can show off that we were a part of this?
Yes.
Of course. Mhm.
Hey, Kate, I'm not visible, I don't think, but am I visible to other people? Oh, well, that's okay.
I can see you, Amy.
Oh, good. Okay, I can't see myself. Again,
Amy, before you do, hold on. Can we just take a quick picture? I'm sorry. Everyone
yes,
smile.
absolutely.
Hold on one second.
Wait,
All right, everyone smile.
Kate, you need to get rid of the slide.
Yeah.
Oh, sorry. It shows differently. No, it's fine. I can see it on my screen, so it's okay. It shows differently on my screen. All right, everyone ready? Cheese.
Please.
All right, I'm gonna do one more. Hold on one second. 1, 2, 3. Awesome. Thank you. Okay, Amy, go ahead.
First of all, I just want to give a big shout out to Kate, who has been working valiantly to organize this, as well as, her leadership. She is our first paid full-time executive director, and we've seen huge transformation in the organization. Our objectives were to promote collaboration and also highlight that patient family organizations are often seen as just sort of fuzzy stuff, peer support, but we've really seen the impact of that. In terms of research, we heard about the importance of including those voices in both the generation of hypothesis and the need for transparency, and then data. That data is essential for improving quality and advocacy. Specifically in advocacy, we heard the importance of coalitions. That can be hard. One word that people didn't say is competition. Lots of groups compete. And so how do we create, as Mark said, one thing we're asking for and take our constellation and make sure we identify the star? And then just to circle back finally briefly to Kate's message that Global Arch believes that patient family organizations are essential for transforming this landscape. At the same time, it has to be a patient-provider partnership. We're not a stakeholder. Patients and families are not a stakeholder. We are at the center. We're more than the stakeholder, but there's all these other people around us, the stakeholder organizations who share our goals, and we have to go in partnership. So we really want to continue to encourage those connections because the groups that have the biggest impact have those connections. They work with those communities, whether it's government, researchers, clinicians, probably other people too. So again, thank you so much. A lot of people have talked about wanting to continue connection and get support. If you are a patient family leader, we have our WhatsApp group. If you're from one of our partner organizations, please reach out to Kate and we can develop those connections for you as well. So with that, thank you. And this has been an amazing 2 days.
Thank you, everyone. And we also put the link to our post-assessment in the chat. So please complete that and we will send it by email as well. But we ask that you do please review that and fill it out so that we can adjust our summits in the future to the needs and the feedback that's provided. Thank you all, and thank you. Have a wonderful day.